Locate your pre-assembled emergency endophthalmitis pack. Check that the required equipment is present and prepare each antibiotic injection according to the enclosed instructions, ideally with an assistant. Disinfect the surfaces to be used and preserve field sterility using a no-touch technique. All aspects of the specimen collection process should remain sterile at all times. For full detailed guidance on intraocular sampling, please refer to the latest guidelines on MicroGuide or the Trust intranet. Please note that we no longer need both AC and vitreous taps for all cases as highlighted on this slide. Ensure adequate anesthesia. A subtenon's block can be used if necessary to minimize pain in an inflamed eye. Mark the injection site with the disposable caliper dipped in iodine, 3.5 mm from the limbus if aphakic or pseudophakic, or 4 mm if phakic. Soak a cotton bud in tetracaine and hold on the injection site for a few seconds. Use a 5 ml syringe with a 23 gauge short blue needle and insert the needle into the marked site, aiming towards the optic nerve to the center of the vitreous cavity, and then slowly aspirate. Aim for 0.3 ml of vitreous fluid, that will be 0.1 ml for bacterial fungal culture and 0.2 ml for the PCR. Make sure you or your assistant can see the gauge markings so you know how much sample you have aspirated. Then, using the cotton bud at the entry site, gently withdraw the needle from the eye and lay the syringe carefully on the sterile field, or pass it to your assistant. For anterior chamber tap, use a 1 ml syringe attached to a 27 gauge or grey hub needle. Keep the bevel of the needle pointing up towards the cornea, making sure that you or your assistant can see the gauge markings. While entering the eye, keep the needle parallel to the iris plane and over the iris stroma, taking great care not to touch the lens. Slowly aspirate 0.1 ml of aqueous for bacterial fungal culture, or 0.2 ml for viral PCR, and withdraw the needle. For PCR samples, remove the needle and seal the syringe with a red stopper. After vitreous and/or aqueous samples have been taken, mark the injection site again. Visually inspect the 1 ml syringe containing antibiotic drugs that you have prepared. This should have a 30 gauge or yellow hub needle attached. Ensure that the volume is correct and insert the syringe into the injection site. Note that the eye may be slightly soft after tapping, and if so, consider applying gentle counter pressure opposite to the injection site with a cotton bud. Withdraw the needle once the drug has been injected. Again, use a cotton bud at the entry site. The culture bottle vacuum must be broken to avoid inadvertent extraction of the entire content of the syringe by the vacuum. To do this, insert a sterile needle for a few seconds. A gentle hissing noise should be heard. Remove the needle after this and discard safely. If you have extracted 0.3 ml of vitreous, you will need to split the sample to send 0.1 ml for culture and 0.2 ml for PCR separately. For the culture sample, first carefully inject 0.1 ml of the sample into a pediatric culture bottle. For the PCR sample, cap the syringe containing the remaining 0.2 ml of the sample with a red stopper. Do not send needles with the syringe. Attach a patient label to both the culture bottle and the syringe. Be sure to complete the correct forms for culture and PCR, including the date, side, and type of sample before sending the samples urgently.